Hello and welcome to a special video on medical calculations. In this video, I'll be showing you how you can use an approach known as dimensional analysis to solve problems involving medical calculations. It's a very simple approach that you can apply to any problem given to you. So let's begin. Now, there are three types of questions you come across when you're dealing with medical calculations. The first one is what I call the one-factor problem. So the approaches are one-factor problems. And the second one, you have two-factor type of problems. And the third one will be the three-factor problems. Okay. So if you consider the one-factor problem, these are problems where you are changing, for example, let's say you have milligrams, you want to change that to grams. Okay. Or kilograms to grams. Okay. Those will involve one-factor problems. Now, two-factor problems, you see units like milligrams per kilogram. So you have two units like this. Or you could have drops per minute. Okay, that's GTT, that represents drops per minute. So you have, these are like two-factor type of problems and so on. So anytime you see something, one unit per another unit, it's a two-factor type of problem. Now, three-factor problems will involve units like milligrams per kilogram per day. Those are three-factor type of problems. Okay, so as I go on, I will show you how you can set this up using the dimensional analysis approach. Okay, so basically when you're using the dimensional analysis approach, it's almost like proportion, but you do all the steps together. For example, if I want to convert 1,000 milligrams to, let's say, grams, you always have to start with the given, all right? The given. So I'm going to write down the given, start with the given unit. Okay. Then you multiply the given unit by a series of conversion factors. So I can have a conversion factor here. Could be one, or it could be a series, maybe another conversion factor. and so on, till you get your wanted quantity. Okay, so start the given quantity, multiply by a series of conversion factors to give you the wanted. It may be one conversion factor or several conversion factors, okay, depending on the problem. So let's apply it to this question here. So my given is going to be 1,000 milligrams. So write that down. Then times, okay, the series of conversion factors. What conversion factor am I going to use here? Right. Now, we know that you have 1 gram in 1,000 milligrams, right? 1 gram in 1,000 milligrams. So let's write that here. So I have 1 gram for every 1,000 milligrams. Okay. So this is the conversion factor. Okay. Now it's a ratio. I can always play with the ratios. I can flip them. The numerator becomes a denominator, denominator becomes a numerator. So this is the same as saying, I can say that 1,000 milligrams is equivalent to 1 gram. They're all the same. Okay. 1 to 1,000 or 1,000 to 1. You know, I can flip them. And so the choice of the conversion factor I'm going to use will depend on what I want to end up with, the unit or the quantity I want to end up with. Here, I want to end up with grams, right? So at the end, I want to end up with grams. Okay. How can I end up with grams? I have to choose a conversion factor, right? So either this one or that one. I have to choose one of them. I have to the one that will help me end up with grams when I cross out the units, right? So most of the time, the one that I want to end up with should be in the numerator. Okay, so since I want to end up with grams, it means I have to use this one, right? So that grams will be in the numerator. So I could put 1 gram here. Let me use a different color. So I'll have 1 gram is equivalent to 1,000 milligrams, like this. Okay, so how can I know my setup is correct? Let's see. Now the milligram will cross a milligram here. If you think you're going to get confused, you can just put this over 1, like a placeholder, right? So the milligram here will cross this out the milligram there. What unit do you have left? The unit I have left is grams, so that matches my wanted. So in dimensional analysis, you would know whether you're right or wrong just by setting up the problem, crossing out units. If you don't arrive at the wanted quantity, then you know your setup is wrong. You have to go back and rearrange your units very well. That's the beauty of dimensional analysis approach. Okay, so in this case, when we cross out, then we have 1,000 divided by 1,000. In other words, 1,000 to itself is 1, 1,000 here is 1. So 1 times 1, they have 1 gram. Okay. So this is how you use the dimensional analysis approach. Okay. I'm going to do one more problem on this, and then we can apply it to some other problems. So let's make this a little longer. Let's say that I want to change. So let's say we have example 2. Example 2. We have 1,000 milligrams. Okay. I want to convert this to all the way to maybe kilograms. Okay, change to kilograms. Okay, so let's do the dimensional analysis approach. So I'll start with the given. The given quantity is the 1,000 milligrams. That's what is given to me, right? So 1,000 milligrams. Now I can change the 1,000 milligrams first to grams. You can know there's a relation between milligrams and grams. So I'm going to say 1,000. We know that we have 1,000 milligrams. It's equivalent to 1 gram. Okay, so that's a conversion factor that we know. We also know, so I'm going to box that, that's 1. We also know that we have 1,000 grams in 1 kilogram, right? 1,000 grams, 1 kilogram. So starting with our given, I can change the milligram first to grams, right? I'm first going to change grams. So let's see, we have milligrams. We change that to grams first. And from grams, we change to kilograms using the conversion factors. So I start with my given, so 1,000 milligrams times, change that to grams. So which conversion factor am I going to use? I want to end up with grams. So I should have grams in the numerator, and I should have milligrams in the denominator, okay? So that if you have crossed out the milligrams, I'll have grams as my unit. Okay, so it means that the conversion factor that I have to use, I have to use what is here, but then the grams have to be in the numerator. Okay, so I'm going to end up with 1 gram here over 1,000. So you flip that conversion factor so that you can cross things out. So if I look at this, milligrams can cross out, milligrams, cross milligrams. Then what I have is in grams. As I said, we don't make any errors. You can always put this over 1. Then you know that it's in the numerator. So now I have grams. I have to change grams to kilograms. So I keep going. I multiply by another conversion factor. I know the relation between kilograms and grams as I have here. Okay. So I want to end up with kilograms. That means that the kilogram will have to be in the numerator and the grams will be in the denominator. Okay. So I put a kilogram here and a gram should be there. Okay, let's see. So you see that this will cross out grams, cross out, the units will be in kilograms. So we're on the right path. Okay. So when this 1 kilogram is equivalent to 1,000 grams. Okay. And that gives us the unit we want, which is in grams, before you even multiply out whatever you have. Okay. So let's cross out what we have here. So 1,000, we'll cross out 1,000 out. So we have 1, 1. So 1 times 1 times 1, that's 1. We still have 1 over 1,000. Okay. Which is the same as, if you're dividing by 1,000, it's easy to do that. Move the decimal point from the end towards the left. Okay, 3 places. Yeah, so you have 1, 2, 3. So that means 0.001. Okay, so 1, 2, 3 kilograms. Okay. So that's your answer. So dimensional analysis approach, very easy to use, and it helps minimize errors. Okay. All right, so let's apply this to some other problems here. So the first question says that you have 5 ml of 0.9% normal saline is ordered to run over 8 hours. How many milliliters per hour should the IV pump be set for? Okay, so we've been given 500 ml of normal saline, right? Running over 8 hours, so that's the time duration. And the question says you want how many milliliters per hour should IV be set up? So these are the highlights. You want milliliters per hour. What does this mean? I want to end up with milliliters per hour. So let's see. To end up with milliliters per hour, it means that I need to have milliliters in the numerator and hour in the denominator per hour. So milliliters divided by hour. Okay. How can I get that? I've been given ml, so that's 500 ml. So that is 500 ml divided by the time, hours, over 8 hours. Okay. So if you look at this, it matches, right? 5 ml numerator, hours denominator, and that's the unit we want here. Okay, so if I divide 500 by the 8, then I'll have the answer that I want. Okay. So you can divide that using your calculator or by hand. So you have 62.5 ml per hour. Okay, so that will be your unit, your final answer. Okay, 62.5 milliliters per hour. Okay. All right, let's look at the next question. So it said the physician orders sapodozine, Prozital, 0.2 grams. On hand is 100 milligram per 5 ml of the medication. So how many ml would be administered? How many ml will be administered? Okay. All right. So let's look at the highlights of this question. So the highlight of this question, the physician orders 0.2 grams of the medication. So I'm going to highlight that. So that is going to be the given, okay? And then on hand is 100 mg per 5 ml, 100 milligrams per 5 ml. And I want to find out how many ml will be administered, okay? So our given quantity is 0.2 grams. Our conversion factor is going to be the on hand. Okay, so the on hand is a wanted, sorry, is a conversion factor. Your on hand. (100 milligrams per 5 ml). So that is your conversion factor. In this case. And wanted, you want to end up ml. Okay. So what do you have to do? We have to play with the given information in order to get to the wanted. So let's see how we can set this up. So as I said, start with a given. So we're going to start with 0.2 grams. That is a given. Okay. When I look at the on hand, my conversion factor on hand here, the unit is milligrams per 5 ml, right? But I have grams. That means that I need to convert the grams to milligrams. So I'm going to convert the grams to milligrams using the dimensionalized approach. So let's do that now. So let's multiply this by a conversion factor. I want milligrams. So the milligrams will be in the numerator and the denominator will be the gram, right? So that the grams can cross out here. What's the conversion? I know that 1,000 milligrams is 1 gram. Okay, so let's cross this and see. So grams here, cross out these grams here. So what we have so far is in milligrams, all right? Now I can use the conversion on hand. Okay, the on hand conversion. So the on hand we have 100 mg per 5 ml. Okay, I want to go all the way to ml, right? So to get to ml, it means that when I'm using this factor here, the ml has to be in the numerator. Whatever I want to end up with will be in the numerator. So I have to have that in the numerator. So 5 ml should be in the numerator. And the 100 milligrams should be in the denominator. Okay. So check the units and see before you start multiplying. Okay. If it's not right, then you know there's something wrong from the word go. So don't waste your time. So let's see. So the milligrams crosses out, it crosses this out here. My answer is going to be in ml. So this will go to ml. Okay. And that's exactly what I want. I want to end up with ml. So the setup is perfect. Now we can simplify this. Okay. So my zeros can cross out, 2 zeros, 100 will cross out, 100, 2 zeros here. So what do I have left? I have 0.2 times 10 times 5, right? So 5 times 10, that's 50. 50 times 0.2. So that will give us 50 times 2, that's 100. 1 is my place, so that'll be 10. Okay, so that's 10 ml. So you have to give 10 ml of the medication. So dimension analysis is an easy way of solving these problems. Okay. Okay. All right. Let's try another problem here. All right, this question says, the doctor orders vancomycin 20 milligrams per kilogram per day. The client weighs 185 pounds. How many milligrams will the client receive per day, right? Per day. So the key information, this is order. Okay, Q 6 hours means every 6 hours. The client weighs 185 pounds, so very important information. And for A, we want to calculate how many milligrams will the client receive per day. So these are key statements. So let's summarize this. So remember, you need your given quantity, know your on hand quantity, which is going to be one of the conversion factors, your on hand. And then you have to identify your wanted, your destination, where do you want to get to. So given, you have 20 milligrams per kilogram per day. On hand, right? Okay, in this case, we don't have the on hand here, but we know the weight of the person. So weight, 85 pounds, 185 pounds. Okay, wanted, want to end up with milligram per day. Milligram per day, that's what we want to end up with. Okay, so far this information that we have. Okay, it's not always that we will have the one hand version here, so we don't have that in this particular case. I'll cross that out. Okay, so let's start up a problem. As I said, you always start with a given. Now look at how I'm going to do this. This is an example of a three-factor problem, because you have 3 units here. Okay, so it's a 3-factor type of problem. Here, milligram, kilogram per day. Now, this is how you're going to write it when you're doing dimensional analysis. Write down 20 milligrams, right? So the first you need to be in the numerator, over, then you write the kilogram per day in the denominator. write this in a denominator like this. So 20 milligram per kilogram per day. Okay. Now times, this is kilogram, right? But I have pounds. I have pounds here. So how do I change kilograms to pounds? I have to do that conversion first. Okay. So how do you change kilograms to pounds? We know that we have 2.2 pounds in 1 kilogram. 2.2 pounds in 1 kilogram. So we're going to change the kilograms to that. So I have to use conversion factor. 1 kilogram to 2.2 pounds. Okay. Okay. So you see the kilogram here, the units here can cross this out. Okay. So we have pounds left here. Now I can factor in my weight. The weight is 185 pounds. So I'm going to multiply that here. So that's 185 pounds. And I can just use 1 as a placeholder for this. Okay. So this portion means that all this part here means I'm changing the pounds to kilograms. Sorry, the kilograms to pounds. Okay. Somebody can do this at the beginning. You can start with 185 pounds and change to kilograms first, and then proceed from there. You come out to the same answer, provided you cross out the units and end up what you want. Okay. So far, what we have now, I can cross out the pounds. When I do this, then the pounds will now cross out. So you see, what do I have here? I have milligrams per day coming out. And that's exactly what I want to have at the end. So my setup is perfectly right. Okay. So I'm going to end up with milligrams per day as my final unit. Okay. So everything is in the right position. So this is the time to work this out and come out with your answer. So if you work this out, it means we have to multiply 20 by 185 and divide by 2.2. Okay, so 20 times 185, that gives us, you have 3700 divided by 2.2 times 1, so that's 2.2. Okay, so what this gives us, so divide your answer. $3,700 divided by 2.2. So that will give us 1.681, sorry, 1,006. 1,681.8. So that'll be milligrams per day. Okay. So that'll be our answer. 1,681.8 milligrams per day. Okay. Great. Now the other one says, how many milligrams would a client receive per dose? Per dose. So the patient is, or the client is receiving 168. Okay, that's what we have here. I'm going to write that here. So we have 1681.8 milligrams per day. So I can write this over 1 day. Okay, that's like 1 day. Per day means 1 day. Times, I want per dose. How many times the patient being given the medication? If you go by the question, the person is being given it here. You can see every 6 hours. So it means 6 hourly, right? 6 hourly. So 6 hourly, how many times is a person going to receive the medication? You have 24 hours in a day, right? 24 hours in a day. So it means that you have to divide your 24 by 6. So you have 4 times given this medication 4 times. In other words, we are giving 4 doses per day. So we can factor 4 doses per day here. I'm giving 4 doses per day. So 1 day, since the day is here, and I want to end up with milligrams per dose, right? Here, milligram per dose. So I'm going to write this as 1 day, the person is getting 4 doses, okay? So let's see. If you have day crosses out, so I end up with the desired units, and the desired units to get milligram per dose. That's what I want to end up with. Okay, so I have all the units in the numbers in the right places. So if you work this out, then you have 1681.8 times 1, which is 1681.8, and then you're dividing this by 4 times 1, which is 4, divided by 4. So it means that the patient is going to receive 420.45 milligrams per day, which is the same. If you run to one decimal place, it's 402.5 milligrams per dose. Okay. Okay. Right. So that's how you apply dimensional analysis to work out this type of problem. Now we can apply the same knowledge to medications that involve IV, like given drops. Was given drops of medications. So here you have 10 ml of dextrose in saline to be water to be infused over 30 minutes in an IV tubing with a drop factor of 15 drops per minute. So GTTS, that's drops. So I have drops per minute. How many drops per minute should be given? How many drops per minute should be given? Okay. So what given here is your 100 ml. Okay, given. And you're given that over 30 minutes. Drop factor is given. So it's going to be one of the conversion factors. We're going to end up with drops per minute. Okay, so let's say we can set it up. So let's start with our given 100 ml is what I have been given. You're given this over 30 minutes. You see, if you look at it, you want to end up with drops per minute. So your answer, you want to end up with GTT per minute, GTTS per minute. So it means that I need to have minutes in the denominator, right? So I can say 100 ml over 30 minutes. I can put the 30 minutes here, 30 minutes, because it's in the denominator, right? Times, what conversion factor do I need here? I've been given drops per minute. If I look at it, wanted, I have drops in the numerator, right? So it means that this is going to be in the numerator. The way it is good. So I have 15 drops per 1 ml right here, okay, per ml. So 1 ml. What do I have so far? Let's cross and see. So the ml crosses out. So I have drops per minute left. Okay, so beautiful. You can see that right away. Drops per minute coming out. So I have to multiply this out and I get my answer. Okay. So I have 100 times 15. Let's cross some zeros out. 30. I can 15 to itself is 1. 15 to 30 is 2. Okay. 2 into itself is 1. 2 into 100 is 50. So nothing else to reduce. So we can just multiply horizontally. 50 times 1. So that would be 50 over 1 times 1. So that would be 50 over 1. So this is equal to 50 over 1. So we end up with 50 drops per minute as our answer. Okay. All right. So again, dimensional analysis makes your life very easy when you're working out problems like these. Okay. All right, let's try one more problem here. So this is an example of a three-dimensional, three-factor type of dimensional analysis problem. It says the physician orders prednisone 0.15 milligrams per kilogram per day, PO, for a 14-year-old client who weighs 110 pounds. And you have available prednisone 2.5 milligrams per tablet. How much should be administered? Okay. So let's start with the order here. Okay. And then the person weighs 110 pounds. Okay. Now this time, let's try and convert the pounds to kilograms, and then we can use the conversion factor. I just want to flavor it a little bit. Okay. But you can start with this one and then go that way too. You come with the same answer. So let's start with the conversion. So I have 110 pounds. I need to change to kilograms because I have kilograms in here. So I'm going to multiply by the conversion factor. I need to have pounds here and then the kilograms there. What's the relationship? 2.2 pounds is 1 kilogram. Okay. So if I check the units, pounds, cross up pounds out, the answer will be in kilograms. Okay, kilograms. All right, so now I can factor in my conversion factor here, which is the order. So it says give 0.15 milligrams. Since it's a three-factor problem, all this here will be in a denominator. So I'm going to put that in kilogram per day in the denominator like this. Okay. So what happens? I can cross out the kilogram here, take out this kilogram here. What do I have here? I have milligram per day left here. Milligram per day. Okay. So how many tablets am I going to administer? Okay. How many tablets? Now I have available on hand, I have 2.5 milligram per tablet available. Okay, so I can factor this into the problem. So let's factor that in here. Okay, so if I factor that in here, what am I going to end up with? Since I want the number of tablets, I can say one tab contains 2.5 milligrams, right? So I'm playing around with the on hand, 2.5 milligrams for one tablet. So I can say that one tablet is 2.5 milligrams, playing around with the conversion factor. Okay. So what do I have here? So I see that the milligrams can take out these milligrams. So the answer I'm going to end up with will be equal to the number of tabs per day. That's what I'm going to end up with, right? Tablets per day or tabs per day. Okay. So since I have everything in the right position, I can now multiply. Okay, so let's multiply the numerator. I can put this over 1 so I don't make any mistake. Okay, so you know it's in the numerator. So let's check our answer. So you have 110 times 0.15, and that gives us, you have 16.5 divided by, so we're going to divide that by 2.2 times 2.5, and that gives us 5.5 in the denominator. So if you divide these two, divided by 5.5, you end up with 3. So this is equal to 3. So it means that we have to give 3 tablets per day for these clients. Okay. All right. So this is where we're going to stop for this part of the lesson on medications involving dimensional analysis. Stay tuned for more videos like this. Bye.